Hey there, this is Adam Cooper with Senior Healthcare Insurance, and in this video I'd like to take a few minutes to talk about the two main health plan options you have when it comes to your Medicare benefits. Now, if you're someone that's retiring and you're able to keep your group insurance from your employer, then this video may not necessarily be for you. However, I would suggest you go ahead and watch it completely. That way you at least know what's available. And the reason I say that is several years ago, I did have someone call me and say, hey, I want to take a look at what's available because my group insurance from my employer, it's just creeping up in premium and it's becoming unaffordable. So after we looked at everything, I was able to save her over $2,000 a year, not a month, a year in premium, and give her more comprehensive coverage. Less out of pocket because she had a bigger deductible and things like this. But that's why I suggest to at least take a look at what's available as opposed to just blindly taking your employer coverage and keeping it for years and years and years. I know you've earned it, and I completely understand that, but at least take a look at it. So the two main options. This card right here, you're going to get in the mail. It's what we're going to call Original Medicare. Okay, it's got two parts to it. Part A is your hospital insurance. Part B is your medical insurance. Medicare Part A typically does not have a monthly premium with it. However, I did come across two people over the course of my career so far that actually was going to be charged. One, she never worked. She never paid in the system. She had Medicaid. Didn't really matter to her because she had Medicaid. The other person was a Mennonite. They decided to take some tax options and end up not paying into the system. So when they wanted to sign up for Medicare, they had a monthly premium. Now, so for most everybody, there is no monthly premium as long as you or your spouse worked and paid in at least 40 quarters, 10 years into the system. So Part A, done. Inpatient hospital stays is what that's for. Medicare Part B, anything that's outpatient, regular doctor visits, specialist visits, physical rehab, you're in and out the same day. Things like just outpatient surgeries where you're in and out the same day as well. That's what Medicare Part B is for. It does come with a monthly premium that's typically held out of your Social Security check every single month. Whatever's remaining gets deposited into your bank account. Now, if you've decided that I'm going to forego taking my Social Security check right now, but I'm 65, I want to take out Medicare, but I'm going to let my Social Security check mature and become, get your full benefits, then you'll have to figure out a way to pay for that monthly premium. Usually either a quarterly payment, monthly bank draft, or charge it to a credit card. Those are usually what most people do if they take that option. Now, with Original Medicare, okay, this is option number one. You can get a Medicare supplement plan, which is a secondary insurance to Medicare. Medicare pays first, the supplement pays second, and you have either no leftover bill to pay or a very small amount to pay, depending on the plan that you actually choose. It does not come with a standalone prescription drug plan, so you have to go out and purchase one on your own. Now, both of those things is what I help people with, figuring out which Medicare supplement plan to go with, which drug plan to go with, and if you need help with those things, feel free to give me a call. Now, so those two things, the good thing about the standalone drug plan is the fact that there's a lot of different ones to choose from, and basically what we do is we look at what medications you're taking, what pharmacy you use, and we figure out which plan is going to be the least expensive for you based on those two things. Now, with a drug plan, that is something that you need to reevaluate every single year because things change. We want to make sure that you're paying the least out of pocket. And I tell everybody this, all my clients, I tell them, listen, no matter what happens, no matter what drug plan you choose, there's always the possibility that your doctor can prescribe you a medication that obviously we don't know about yet that either is not covered by that plan or is covered at a lower cost on another plan. But of course, we don't have a crystal ball telling us what our future is going to be. So that's why I say you need to reevaluate that every single year. And even if your medications don't change, the plans change. So their cost share, meaning the co-payment that you pay or what tier level they're on may change, or their monthly premium may change. So it's really important to go ahead and reevaluate that every single year. So that's option number one, Original Medicare, a supplement plan, and then a standalone drug plan. Now, the other option is what's called Medicare Advantage. This is also known as Medicare Part C. So what Medicare Part C does is it combines your A and B benefits into one card, and that actually is comes through a private insurance company. What happens is when you enroll in a Medicare Advantage plan, Medicare sends that plan money every single month to administer your health care benefits for you. Now, the premium on that plan is much, much lower than, say, a supplement and a drug plan combined. However, whenever you go to the doctor, the hospital specialist, ER, hospital stay, anything like that, you are going to have a copayment associated with it. And if you don't go to the doctor very often, that may not cost you very much. But I would advise you to not only think about what your health is today, but think about what it is going to be 10, 15, 20 years from now. Because with a Medicare supplement plan, you have a certain window of time that you can get one of those plans without having to answer any health questions. And therefore, it's automatically assumed that you're going to get it no matter what. Sign on the dotted line, you get it. Okay. With Medicare Advantage, there's one health question, and that's, do you have end-stage renal disease? And that is, do you have kidney failure and typically requiring dialysis? If that's the case, a Medicare Advantage plan is not even an option for you. And I would highly suggest go ahead and just get that supplement plan as soon as you're eligible for Medicare, for sure. Now, so Medicare Advantage, Part C. Again, what Medicare does is it sends them money every single month to administer your health care benefits for you. And in turn, what happens is whenever you go to the doctor, the hospital, or specialist, whenever you file a claim, actually your doctors all do that. Whenever they file the claim, they don't actually send the bill to original Medicare like they do if you have original Medicare and a supplement plan. They send it to that insurance company. That insurance company pays your claim, leaving you some portion to pay on the back end. Now, if a Medicare Advantage plan sounds like it's the right thing for you, which again, we don't know that yet because everybody's needs are different, everybody's budget is different, I would highly suggest getting a secondary plan that helps pay for some of those higher cost items, and then probably a cancer plan to go along with it. That's what I suggest. Now, if you are the other thing that you need to know about Medicare Advantage is it comes in 3 different ways. One is a private fee-for-service, which is far and few between. You're not going to find a whole lot of those out there anymore nowadays. But back in the day when this was first introduced, there was no network whatsoever. You just go to any provider that you want to, as long as that provider is willing to accept that plan's payment terms and conditions and accept you as a patient, then you're good to go. Like I said, very few of those even exist nowadays. If you do find those, they're going to more operate like a PPO, a preferred provider organization. So what that means is you have a list of providers that are in the network, and you're allowed to go outside the network, but your biggest savings are going to come from staying inside of it. You can go outside the network, but there's usually a deductible and a higher cost share, meaning a higher amount that you would pay if you go outside that network. Now, let me caution you on this. Just because you're allowed to go outside the network doesn't mean that every provider takes that plan, because they still have to accept you and accept the plan in order to even bill you out of network. So just keep that in mind. The third way that these Medicare Advantage plans operate is by offering what they call an HMO, a health maintenance organization. What that basically means is there is no out-of-network benefit. You have to stay in the network to receive your benefits. Now, that's not to say that there aren't emergency situations that they will cover, because they all do that. If it's an emergency, Medicare Advantage plans have to take care of you in emergency situations, even out of network. Okay. Now, going back to the Medicare supplement, I forgot to mention this. Medicare supplements follow Medicare wherever they go. As long as you go to a provider that accepts Medicare, that Medicare supplement is fine. You can go there also. So there is no network other than the fact that you have to use a provider that's A, willing to take Medicare, because you're not going to go to one that's not, or B, they accept you as a new patient, because just because they accept Medicare does not mean they have to take you on as a new patient. So those are the 2 criteria. So that's with Medicare supplement plans. Again, Medicare Advantage, stay in the network. That's where you're going to get the biggest bang for your buck. Now, Medicare Advantage typically comes with Medicare coverage included, a Medicare Part D plan embedded into that plan. So that's good and bad at the same time. There's no additional premium for it or anything like that, but the bad side is you have to take that plan that's embedded with it, whether it be good or not good, depending on what medications you're taking. So that's something that we have to evaluate and look at and look into to make sure that it fits you, okay? So So again, those are the two main options, either Medicare Supplement or Medicare Advantage. And depending on what you're looking for, what your health coverage needs are, depends on which one's going to be the right thing for you to do. Now, can we all have that crystal ball saying, hey, this is exactly what you need? No. And everybody's needs are different, but it's really important to understand the full spectrum of what's available to you. So I want you to give me a call. My number here is 870-215-3136. And I look forward to speaking with you, and let's take a look at what your options are and help you figure this out. I appreciate your time. Make it a great day, and I'll see you in another video. Bye for now. Talk to you soon.